So our next speaker, Dr. Marissa Magsino, is part of the Orlando chapter, and I still remember the first day she came in. She had like this beautiful jewelry on. It was like these crystals, and I was like, ooh, who are you? Come here. And she was all dressed in black. And I learned something from her. In the Asian culture, she's from the Philippines, that it's tradition to wear black for a year. And then there's a huge celebration the day you get to wear color. And which, it's funny because after that happened, I actually started studying Dressing Your Truth with Carol Tuttle. And I was like, I don't want to dress like I'm mourning. I don't want to dress like I'm masculine. I want to actually dress my energy. I want to wear some color. But I saw what happened to her, and I learned something really important. That there's a lot of different things that I didn't know that could help me, from dressing to eating to thinking to breathing. But Marissa taught me about adrenal fatigue. You guys, starting Modern Widows Club, it got a little crazy. Okay, we grew fast. I kind of burned myself out because I'm an interior designer. I was doing that job. I was raising teenagers in menopause. Oh, I like that laugh. Does someone have any mercy for me? And Marissa said, girl, have you ever had your hormones checked? I was like, what? Former nurse, what? No. Well, maybe you should. Well, it was basically like in adrenal fatigue. It was proven. And she said, there's a way that if you balance your hormones, if you understand how it affects you, you might be able to be more calm. You might be able to actually find that 5 minutes. You might be able to, it might not even be you. It's just your body off balance. And I said, tell me more. And so I said, come on, you got to come and tell us more. So welcome, Dr. Marissa Magsino.
Thank you so much. Oh my gosh. Well, ladies, there's really truth to that. I was wearing black the whole entire year, and his closet, I filled it with all black dresses. And it was actually still timing that the day after his first death anniversary, it was very cultural that I wore this blue dress on the day after. So this is a celebration for me to share with you, my widow sisters, and today I feel my heart is so warmed because this is a different audience. I had to actually change my slides. I present to physicians, I train doctors about the science of bioidentical hormones, and I do give talks to patients as well. But to me, this is so different. This is home. So today, this afternoon, we had a feast of great lunch today. I would like to share with you, as a scientist, the approach to the anatomy of grief. Now, we're going to discuss today the cascade of hormonal events. As you know, the death of the spouse is the #1 stressor in all the scale. They rated all the scales of stressful situations in life. The death of the spouse is #1. So I'm going to discuss about cortisol, the stress hormone related at the onset of the most stressful event. Then we're going to discuss the physiological issues of menopause. Why? As Carolyn had mentioned, the average age of a widow is 55. Okay? We're going to discuss third, the objective will be to discuss the health issues of aging widows. We have to face the dilemma of physiological aging. That includes osteoporosis, Alzheimer's, dementia, and heart disease, to name a few. And last but not the least, we have to take care of ourselves. No one else is there. We have to be active with preventative measures. There are things that are out there openly including the use of bioidentical hormone, which she had mentioned, versus, I'm going to discuss about the controversy behind bioidentical hormones and synthetic hormones. For those of you who are from Dallas, Texas, this is a great way, because I would also let you know I was trained by a physician there in a bioidentical hormone pellet that was done in Dallas, Texas. And then, of course, we're going to discuss about supplements combined with therapy, and if you have questions, we'll take care of that. So what happens? The stress hormone. Cortisol is your fight and flight hormone, okay? That onset, whether it was sudden death, like I had read here, my husband passed away from a massive heart attack, his very first, at the age of 51. I'm a physician, I faced it, I saw that, and I had to deal with it, perform a CPR. It was a surge of my cortisol, a fight and flight reaction, and that led me to shock. Shock will raise your cortisol level, and you can only fight and flight at a certain moment of time. So that involves the dynamics of your body, your mind, your behavior, your emotion. It's a catharsis of everything happening all at the same time. It's almost like your whole entire being, your system, and I'm sure all of you have experienced that. From headache to frequent infection, to taut muscles, to muscular twitches, the fatigue, the skin irritations, the breathlessness. How many times do we feel like we're catching? We are breathless. That's why the meditation this morning, which unfortunately I missed, is very important. We have to learn how to breathe. This is when the breathing, when you're mindful, that your cortisol level will come down. The mind, we worried, what's going to happen to me, my children? What's going to happen to everything? You have muddled thinking, you have impaired judgment, nightmares. You don't know what's going to happen tomorrow. You fear about losing, as everyone knows. It's not losing just the loved one. There's circumstances that follow this, material and spiritual and emotional. Indecisions, negativity, and hasty decision. That's why it is very important. This is great for all of us to be together, because the empowerment that we get from workshops like this prevents us from getting more stress and being unmindful. And we want to prevent making those indecisions and hasty decisions. In fact, one of the best things is the nurturing that we get from each other in this type of workshop. So thanks to Carolyn, really, for founding such a program like this. This increases our risk to be accident prone. I know some of you had accidents. I had an accident right within the year he passed away. I had a car accident not knowing, because our mind gets muddled. You think about memories. I had post-traumatic stress, so I was driving, trying to get to my office, and all of a sudden I get hit. Our behavior are affected by stress and the cortisol surge. We lose our appetite. We have no desire to do anything. Of course, much as all, we become, as we have, sexless. You don't even feel that there's a feeling, the drain. There's insomnia, restlessness. Some may result to drinking alcohol or smoking more. Whatever it is, it was a crazy situation where cortisol level goes up. There's loss of confidence, more fuzziness, irritability, depression, which we all are aware of, apathy, alienation, and apprehension. So this is the woman, classically, that I see in the office. Not to mention, she's not even a widow. What happens? You go through the surges. We all know that a loss is a loss. There should be, like as Elizabeth Kubler-Ross, you go through the stages of death. And at first, you get angry. This brings out this hormonal havoc before you actually accept it. There's many stages we all had to go through. I had to go through that, the bargaining, the anger, before you finally accept it. And then the fact is, age 55 to 56, there are some young widows here. So bear in mind, those hormonal changes can happen at age 35 to 40. And I'm going to discuss in details this hormone. So you could be preventative of your own situation. You could hone in and find that if there are changes in the way you feel, you know that these hormones can be precipitated and can directly affect how you feel. However, for those of us, I'm in that age category like Carolyn, menopause is defined as the complete cessation. You stop having period for 12 months. But before it stops, there will be symptoms. And one of the symptoms would be mood swings. You're anxious, you're depressed, you don't know what's gonna happen, and your children doesn't know what to do with you, okay? Mom is crazy, and crazier because she lost dad. And then one time I remember my children said, Mom, we're not dad. You can't tell us this. Oh, okay, I'm sorry. I just need somebody to listen to me. So fatigue, I'm tired all the time. So cortisol is not the only hormone that can give you fatigue. Menopause can do that. You could be also having body aches. You won't sleep. You get this hot flashes, and hot flashes described as the heat coming from the center of your heart, and then it makes you glow. Okay. I call it a hot surge, or I'm hot. Okay. Headaches. And of course, nobody wants this, but you gain weight in the midsection. That's why it's called middle age. Whether you go through that. So it's not just us, women, but men. The way I would advise you, when you look at a person, you know she's not healthy or he is not healthy. When you look, symmetry. If there is a big asymmetry or some apple here in the front or some gunk right there, that means that's not healthy. This will guide all my widow sisters who's looking for the new mate. Look at the belly. Do the belly check. If there's some fat tissues there, uh-oh, that's trouble. That's insulin resistance. All right, so skin itching. So let me screen them first. We're gonna look at their hormones. All right, skin itching, vaginal dryness, and loss of desire or libido. So what are the facts? HRT stands for hormone replacement therapy. Every day, 3,500 women enter into menopause. Symptoms of menopause can come in 15 years earlier. In men, they call it male hypogonadism. It's present in 39% of men and over 45 years of age. Men also lose testosterone production per year after the age of 35. So in women, there are challenges to aging, especially women going through hormonal changes. So imagine we're already adrenally fatigued. We lost our cortisol is on the upsurge. Adrenal fatigue, by the way, means you have been so stressed the whole entire 1 year, 2 years, 3 years of your life losing your spouse, and then your cortisol will shut down. That's adrenal fatigue. And this could be measured by blood work, okay? So when you're already tired and you're going through menopause, imagine in the combination or the overlap of symptoms happening as you're going through your menopausal changes. You're emotionally unstable, there's loss of energy, you have no desire, you're strained to have this type of lifestyle, your relationship, that will affect your relationship with yourself, with your children, with your co-workers. There is something that we can do. You're not alone. Every woman goes through this. This is the reason why the role of bioidentical hormone, when it's optimized, can actually help you. So I want to discuss the hormones. What are these? There's 3 hormones. We have estrogen, progesterone, testosterone. We all have this. Yes, we do have testosterone. Yes, we have this. But the first thing I'm going to discuss is estrogen. So it has 400 function. It controls your hot flash. It maintains your bone density. Remember our desire to be strong with our bones. It helps maintain your memory. There are now directly correlation of studies showing you can prevent Alzheimer's dementia if we can give your bioidentical hormone or even synthetic hormone, because estrogen is very good for neuronal functions. You have to give this before age 65 because it helps maintain memory. It reduces the risk of colon cancer. Obviously, we know it maintains collagen in your skin, so before you do any aesthetic procedure, I always tell my patients, optimize your hormone. Don't just buy into plastic surgery and get all this expensive stuff for yourself. You have to have a balanced, optimized hormone. Estrogen also increases serotonin, which is our happy hormone discussed earlier, and dopamine, aside from eating chocolate. Remember that dessert? tiramisu. Smoking and stress decreases your estrogen, okay? So your stress, you're going through menopause, you're having hot flashes. It further declines our hormone. So this is tragic for us. Our hormones are in disarray for those of us that are in our mid-50s or early 50s. And then on top of this, all these other hormones happen. So what is this Alzheimer's? To me, I'm more fearful of losing my memory. This is a healthy brain on that left-hand side. A shrunken brain happens when you have Alzheimer's. You know, right now, the number one problem in the medical field is actually the rising amount of cost is because of Alzheimer's disease. We have a lot of women getting into early menopause, and we're trying to, early Alzheimer's disease. We're in the locked-in units, and we're trying to identify what else can prevent these multitasking women. You know, women, we multitask all the time. We use our brain functions more than men. And we are the highest risk for Alzheimer's. So we have to optimize and prevent this from happening. Plaques looks like that ugly picture on the right here, the brown one. And we have dying neurons with tangles, because I want you to be aware that this is now this reality that Alzheimer's is more fearful than having a fall or having cancer. So what is testosterone? It's not just related to sex. Your brain needs testosterone so that you could be creative and you can function. Besides providing major symptom relief, as mentioned, bones, brain, your breasts, your hearts, your joints, and of course your relationship. When you do not have a desire, how can you have a relationship? So what does it do? It is an anabolic hormone. It is responsible for making you lose that midsection gut. It is a very active hormone that also prevents you from having joint pains. Because a lot of menopausal women coming to my practice are achy. I call it the 7 barbs of menopause. When they come in, I'm having aches and pain. I have joint pains here. Testosterone, when it is replaced in an optimized level, you're not going to grow beard or hair or be turning into a man, but that will take care of your joint pains. So men aged 30 to 70 would lose, for the men in the audience, you would lose your hormones 1 to 3% per production every year. Women at age 20 to 40 lose 50% of their testosterone production. It's happening right now, even after lunch. Yes, women make and need testosterone. So when it is replaced, like I have experienced it after the death of my soulmate, it was such a harsh reality. It was hard. Cortisol up, and I know I'm going through all of these different changes. But thank God that not just faith in God and the balance hormone, as I'm sure some of you that have been replaced, had helped you focus. I mean, we grieve. There's no end to grieving. But you can focus. You could be creative. And it's not just sexual. What I don't like is when they see us looking good, they always think we have to validate our presence with a man. I said, no. My validation, that's why I empower women, not just you guys, but I empower a lot of menopausal women, is to make sure there is a feminine power there is within you that you need to nurture, that self-love. And testosterone gives you that boost. It gives you that power to be creative, that power to think, less emotion, like men does, so they're more focused. You could achieve your task, and doesn't have to just be sexual. Okay, what are the female symptoms that happen? You get tired, you're swinging from left to right, from fatigue and tiredness to anxiety and depression. You could cry at the drop of a hat. You can't sleep at night. This is a woman who did not lose her husband. This is a woman who is going through menopause. You can't sleep, can't remember everything. You're driving, and all of a sudden you find, and these are patients coming to me at the practice, I'm driving, and then I realize I'm on I-4, which is our biggest, horrible, one and only. As you know, the locals know, you get stuck in traffic. I don't know where I'm going. I'm supposed to see you, Dr. Magsino, but I forgot. I'm in the middle of I-4, and I suddenly blank out. You have no desire, those in relationship, this is important. If you're in a new relationship, I think nurturing this is very important to be, that desire. When you have no desire, you don't have desire to do anything. It's not just sexual desire. You get filled with depression, and we can't just be all depressed when you're trying to be creative, moving on with new life. These hot flashes are horrible in a weather condition like Florida. I have all these women almost naked coming to the office with a small fan. You see this, Dr. Magsino? I said, yeah. We need to put probably some ice over this, like putting ice all over it, because it's so hot. The sweating at night. Those that are in a marital relationship, the husband will complain, oh my gosh, 65 degrees. All of us are so cold. The woman cannot sleep because she's sweating. And of course, a woman doesn't feel sexy. I'm sure you guys would agree if you gain weight. That's the most common complaint to me. I don't feel sexy. I don't want to have pictures. Why? Because I've gained weight. And that is an impact to relationship. Joint pains, everything is achy. How can you be intimate when there's joint pains everywhere? And then the migraine, this is horrible. Every single day is an effort to just get up and go. Especially when they get tired at 4 o'clock, around this time, shortly later, 3, 4 o'clock, they have to get something like coffee or caffeine to stimulate. This sounds very familiar. So what have they done in conventional therapy? There is a conventional women's health initiative, and I need to tell you this because everybody's afraid, oh my God, it's gonna cause cancer, I'm gonna do this. This was a study which scared all of us because back then in the market, it was only Premarin, Prempro, and all the synthetic hormones. They found it was a small study of older women and high risk. There was 41% increase in stroke and 29% increase in heart attack, but it was really a morbid, sick population. They did not divulge this. 26% increase in breast cancer and twice the rate of blood clot. 76% increase in Alzheimer's dementia. They had no alternative for hormone balance and symptom relief. Sadly, the alternative methods were available only after a few years. So I'm going to discuss what are the other methods that they have. Now they have the pills. The birth control pill has been about 50 years. And between you and I, there has been so much of a high incidence. And we have children that are young women. There's been incidence of breast cancer, uterine cancer, fibroids. How many hysterectomy has there been? As you can see, I'm very biased about synthetic hormone. There's peaks and valleys. There's a first pass metabolism, means when you ingest a pill, it has to go through your liver. That's the first pass. So every single time you take a drug, believe it or not, you have to pass through your liver. So your poor liver enzymes are tired. This is the reason why, in correlation with our nutrition, you have to eat well. You also have to detox. You need to learn how to cleanse at least twice a year, which is I educate my patient, because your poor liver enzymes are always tired. When you consume alcohol, when you don't eat healthy, and then you consume prescription medication, everything goes to your liver. These pills can stimulate your breasts. It is something that you have to take every day, and yes, it causes vaginal bleeding and highest risk for blood clot. That's the first question they're gonna ask you if you end up with a blood clot. Are you taking birth control pill? Are you taking a synthetic hormone? They can give you headache. So these are potential side effects of oral estrogen. There's breast tenderness and increased risk of endometrial and breast cancer, vaginal bleeding, headaches. Some may even throw up, and yes, fluid retention. Blood clots are horrible. So if you had a blood clot, you cannot be on birth control pills. Leg cramps, gallstones, we know, because it produces a sludge, goes through your liver. Patches, we have those Minival, you're given by your gynecologist. Estradiol is better. Levels are better than the pills when they're in transdermal patches, but they're not as good as pellet. There's problem with itching if you have allergies, and they need to be changed throughout the week. Some of you might be on this. And some can gain weight, but less fluid retention than being on synthetic. Or it is the horse estrogen. And I don't know if you guys are aware, but we had only the horse estrogen for years, even before 2002. So it is the horse estrogen that was given to us for many, many, many years. 45% of people do not absorb this hormone through the skin. Then they come up with a gel. Did you have enough? And I need to remind you as women, whoever you touch and you have those cream, you have to have a window of 4 hours, because if you touch your grandchildren, if you touch a child, they will also get that hormone. So have you remembered to rub it daily? By the way, a caveat, if those in relationship, if your man is on androgel, you're getting that hormone as well. So you better not sleep with your partner or those in relationship, because you might grow a beard, especially if you lay down on his chest and he applies it here in his chest. So remember, you don't want to get your testosterone through that, okay? Short half-lives, because it happened to one of my patients. I said, I run her profile. What the heck happened to your testosterone? Why is this high? You're having all some other symptoms. And then on close examination, she told me that her husband is taking androgel. I'm like, that's why your testosterone, you have hormone imbalance. Because you have more testosterone, you have less estrogen now and less progesterone. I mean, going back to the topic, there's short half-life of gels, because you have to do this maybe twice a day for some patient. And then you have to wait for 4 hours till it gets absorbed. You can't go to the pool, even though you wanted to. Then you have to apply at the areas where nobody touches you, like inside your belly or inside your thighs. And like I said, you can transfer. I forgot the pets. Oh my God. By the way, the pets had been my lifesaver. After I lost my late husband, I've had my pets. And they're my companions now. I live alone, but they're my companions. I have a dog and a cat. So the most important estriol, as in the product bias, does not have bone, heart, and brain protection. What are pellets? These are now, I would say, the best way to give you back your bioidentical hormone. They look like little rice grain. It keeps the estradiol to estrone ratio of 2:1. They're biologically identical. What does that mean? Talking about chemistry, the biochemical formation of this type of hormone is essentially very similar to our own. And so they're naturally made from yam and soy, constantly available in the body, time release over a period of time depending on your body's metabolism. If you exercise more, you burn this type of pellets. They're absorbed directly, they're not taken orally. It's a steady state of hormones. There's no roller coaster effect. You don't gain weight. It's hassle and safe-free. And it's individualized. Okay, it's based on your weight, your hormonal level.
How are they administered?
Very good question. So how it is actually a mini surgical procedure. You come to your doctor and you need to get your blood work done. And the procedure is done by putting like an anesthetic, like lidocaine, same thing that they use for your teeth. And then we put a small incision right here in the buttocks where you put your hand and you put your pocket right there. And using a trocar, it is actually embedded into the fat tissue. It doesn't really hurt. It takes about 5-10 minutes procedure, and slowly release, and then you measure your before and after hormones. So it lasts longer than other treatments. So they studied the pellets, so there's no increase in blood clots. It reduces the cardiovascular risk compared to oral. There's no blood clots, so you don't have to worry about the clot going to the heart and causing thromboembolism. It does not increase the risk of breast cancer. The studies were done in '93 by Dr. Smith on the recent advances in HRT at the British Journal of Hospital Medicine. What else? What else would the hormones do? Medical studies. One of the things that are risk for Asian and Caucasian women is osteoporosis. In this, we need testosterone because testosterone is the bone builder. There's a demonstrated 4-fold increase in bone density over oral estrogen, 2.5 times higher than the patches. My personal experience, I was osteopenic, and then after I've had those pellet therapies, compared my bone density, and it has not gotten worse. It actually retained, if not improved, the status that I have. So with osteoporosis, you lose height. The body becomes like crunch over, as you see in the skeleton right here. And there's chances for increased risk of fall and fracture. So it's 8.3% per year for pellet therapy, which is increased. That means your bones are stronger. There's only 3.5% per year for patches and 1.2% for oral estrogen. They did a nurses' health study, and they studied 121,000, almost 122,000 nurses. These nurses were using estrogen which is oral estrogen. And then they also gave them estrogen plus testosterone. So one is estrogen, one is combined estrogen, testosterone. They found that if it is combined with testosterone, there's no increased risk of breast cancer. That's from 95. This is the source from the archives of internal medicine. Oral synthetic chemical methyl testosterone, like estrotest, increases the risk of breast cancer, and the non-oral testosterone, which is in pellet formula, prevents the stimulation of breast tissue and lowers the risk of breast cancer. So my point is, know your facts. Don't panic. Don't say, oh my God, I cannot be on hormone. I'm going to have breast cancer. Know your facts well. Now in this new journey called Life for Us, before we listen to anything, we have to read between the lines and know it ourselves. That's why we gather together like this and empower each other to really know so that we can make the right decision. As I learn from you guys, you are learning from me too. So today, there's hundreds of studies. The take home is testosterone derived, delivered by pellet implants does not increase the risk of breast cancer, unlike the oral synthetic testosterone, like the estrotest. Testosterone implants have shown less stimulation of the breast. Treatment with testosterone and estradiol implants does not increase the risk of breast cancer, even in breast cancer survivors. Now, this is the caveat here. I have this breast cancer patients coming in, and they're afraid. Of course, all right, we're not going to give you estradiol pellet, but I am going to give you testosterone. Why? Your bones need it. Your body needs it. Your mind needs it so that you can focus. And you need it for energy and your libido. So I have given it to patients that are actually breast cancer survivors. So last of the things that are important in hormones, take home. 1 in 7, what is perimenopausal women? These are the women 35 to 45, because it takes 10 years to become menopausal. The process starts around as early as 35 or 40 before you hit 50, 55. 1 in 7 of the women can die of heart disease. For postmenopausal women like me and those in the 50s, that number rises, the ratio rises to 1:3. So why? When you have that anxiety reaction, what happens? You go to the hospital, you go to the emergency room. They're not going to ignore you if you're 50 to 55 years old to 60. Why? Because those doctors know once you're menopausal, your risk for a heart attack is very much higher, or if not equivalent to a man. They're not going to ignore when you come in. I'm having anxiety, I'm having chest pain. So be aware of that. Okay, for those that already stopped having period. Alzheimer's, once again, women get Alzheimer's more. We multitask, we think a lot. We can't shut our mind. We probably overuse our brain. Women get Alzheimer's disease more than men, 8:1 ratio. Oh, this is funny, but we do multitask. We think about a lot of things. During your intimacy, men can think about it. I'm sorry, I forgot to tell you, I have a background in sexual medicine, okay? So I'm certified in functional medicine, hormone, and to top it all, sexual medicine. So a little bit of some sexual medicine here. Women, when they're in that moment during intimacy, are going to think about, okay, I'm gonna feed the child, I'm gonna do shopping, I'm gonna do all this. Okay, come on, get over it, we're gonna fake that orgasm. Oh my goodness. The man with their high enough testosterone, no matter if there's a fire going on next to it, they're gonna go for it and do it and shoot for it. See, I made you guys laugh. Remember the good old times. I had a very great sex life with my late husband. That's what I miss the most. But what I want to tell you is be mindful, because we don't want to have Alzheimer's disease. Be mindful of every single minute that we live. Now that we have survived the unsurvivable, we are very much mindful. Be who you are, be who you want to be, and like I said, this is the best thing we could do, is to be able to prevent diseases that can happen. And now, those moving on with new relationship, empower yourself. That whatever you have missed from prior relationship, you're gonna be even better this time. Especially if you have the right amount of hormones, you know what I mean? And consult me if there's things that you want to learn more, okay? I will, maybe in the next topic next year. When you guys are more optimized and you have the desire, I can give you the power for that. Let me tell you, that's going to be an upgraded version of a topic, right, Carolyn? That's got to be next year. Everybody has to be optimized first with. Everybody has to be optimized with hormone because that topic is a little bit more advanced. This is basic, okay? Women on testosterone are 50% less likely to develop Alzheimer's disease. Men, this is scary. These men with low testosterone are 3 times more likely to develop Alzheimer's disease. One of the things if I have to go on a date is, for a man, what's your testosterone level? You're not going to pass if you're not 700. Sorry. One of my screening tests. So hormone imbalance, symptoms, have you noticed, overlap. They overlap. Whether it's cortisol, whether it's thyroid. I forgot to put a slide here on thyroid. Whether you have a low thyroid, whether you have cortisol adrenal fatigue, whether you're going through menopause, they all overlap. It's almost like the same. And it's get worse at this age, at 50. Can occur in women at any age, but worse in your 50s. So you need to get tested. Low normal may not be optimal. This is the difference between a doctor trained in functional medicine that I did or a traditional doctor, because we do not look at normal as the normal doctors do. There's a range. You want to go beyond that range. You want to opt to be at the higher level, because if you want to function not as a 55-year-old, but a 45-year-old, you got to optimize your hormone. Many labs do not have age-specific ranges. This is something that I had to always criticize with the lab. Their guidelines and ranges changes, so do not be traditional. Get out of the box, be more preventative of your approach to health. There's new ranges for thyroid, because they always think, oh, the TSH thyroid is normal, but it's really not normal from functional side. So what patients are saying, when you get replaced, you have more energy, okay, you have restored your interest in life. So as we're moving forward with our journey called widowhood, it's important when you're optimized, because then you have more interest in life. You have more drive, sexual drive, especially if you have a great partner. But listen, when you do the right meditation, even though you don't have a partner, you can transform that energy to be creative, okay? That sexual energy can transmit to be creative. Doesn't have to be always just stuck down there. There's consistency in moods. Well, I'm just trying to say, because I'm in that creative moment now in my life. Because they always think I'm with someone. I said, no need for validation. I'm creative. Relief from anxiety and depression. There is increased mental clarity. So everybody gets attracted to you because you're clear. You're subtle. You're stable. You're grounded. This is how we create attraction, not only to men, for men, women, everybody else. Well, that widow is glowing. What does she have? What makes her special? Increased mental clarity. We're special because we are one sisterhood like this. We're empowering each other from every aspect, from every topic. Decreased body fat. There's increased capacity for getting the body in shape. That is very important. So you nourish the body, the mind, and the spirit. In summary, the death of our beloved triggers an avalanche of hormonal changes in our body, especially in an average age of a woman who is going through the changes of menopause. There's multiple medical risk, which includes osteoporosis, heart disease, and dementia. These are scary ones, and they can be prevented and modified. Hormones, especially bioidentical hormones, that are optimized and replaced and not using synthetic hormones are the way to go if you want to be optimized. So thank you so much. This is me with my beloved. As you can see, I have my name right there next to him. My grounding place. I have my email there, drmmagsino@gmail.com. I have a website, my name, marissamagsino.com. And it was such a pleasure to share this, but we have a camaraderie, a special sisterhood, thanks to Carolyn. Sorry, her face was cut off there. Here, my widow sister in the audience. We have everyone here that I wanted to also take charge. Like whenever they ask me to come in, I always believe that this is home. That no matter what happens, I feel I could be crazy, it could be me. This is home for me. And that's why of all people that I want to share my knowledge and experience, I feel that we gotta stay. focus and at least help each other out here. So thank you so much. If you have any question, let me know. Do you have any question? Yes, ma'am.
How often do you have to have those implants in place?
Those implants are replaced 2 to 3 times a year, depending on your activity. If you're like those physically athletic sisters here, they have to be replaced maybe 4 times a year because it is burned through blood flow. So if you physically exercise like 5 times a week, then you're gonna have to get that replaced 3 times to 4 times a year.
Can you go through a GYN or does it have to be a specialist?
In different states, so the pellet I use is biotee.com. It's based in Dallas, Texas. I was trained by Dr. Donovich there. So in Texas, it's everywhere in Texas. I think in Georgia we do have it in several states. So you just go on biote.com, and they have providers in each state. Here, I'm actually one of the providers. So this could be, right, like I said, the insurance will cover for your blood work, so you need to get your blood tested for this. So it is very important, especially for our younger widows. Those are in the 40s range. Get it checked now because you want to prevent yourself from going through what we go through in the 50s. There was the question. The insurance only covers blood work, but it will not cover the pellet. And they cost, depending on each state, about $400 per pellet. But if you have flexible savings account, health savings account, that could be entered as your FSA or health savings account. Yes.
Okay, so this is just a testimonial, and obviously I've been empowered because I normally don't share my personal stuff. But just 2 days ago, I got my second round right here.
Oh, you did?
Of the pellets. And I am telling you, for 2 years, I struggled all of a sudden with sudden anxiety and sudden hot flashes and all of this. And I finally found out that my neighbor actually is a doctor and does all of this. And these pellets have the last couple of weeks, I called her and I said, I'm having anxiety again, something has to be going on. And she said, because it's time for you to come in and have your pellets again. But they're wonderful. I mean, you go through your blood, they test your blood, and it's incredible, and then you find out how much you actually need, and then you're given. And I needed a little bit of estrogen, and so I had a little bit of estrogen last time too, and then all of a sudden, it's like my estrogen is really good. I don't need it anymore, so I'm not getting it. But the testosterone, I was like, oh gosh, I don't want a mustache, you know?
You're not going to have a mustache.
But right, exactly, I'm not. And it's been fantastic, and also it's really helped me to really get back in and want to get into my exercise again like crazy. Now I'm craving it again. So it's really, something that I was always scared about. She's incredible.
Oh,
and
thank you.
If anybody wants the pellets, I mean, they're definitely the way to go.
Well,
Thank you.
I mean, me too. I mean, yeah. How old are you, Melissa?
49.
49. So I'm 54, and I think we've been doing this for about 2 years.
2 years now,
Yeah.
yes.
So when I first came to, I was deep in Modern Widows Club. We just became a nonprofit. And we did mine, and my estrogen was so low that she literally told me, you're someone who should be sleeping all day.
I was amazed at your energy. How can you compensate for that when you had no hormones back then?
I was adapting, but I was burning my adrenal out. That no amount of, and you know what it was? I was blaming it on, I was dating, the judgment, the teenagers, I had 2 daughters dating too. I mean, there's so much emotion and expectation from myself professionally with my interior design clients, my love for Modern Widows Club, my mission, my service. I thought it was just energy. No. What I realized was that you can have the energy to do all of those things and probably even more. But I wasn't using what I naturally had, the ability. Hormone, literally, I cannot even tell you what it did. An event like this wouldn't even, literally, I went 2 weeks ago and I said, I know I'm done. This event is coming on, so I need it now. I need a refill.
Give me your bottom.
Yeah, and you took a picture of me. I'm so glad you didn't show a picture of my bum on the screen.
I did not show your bottom. Yeah.
But for me, I really kind of thought I was just, getting old. No, really. You know, I just thought, well, I'm just getting older, and this is what happens when you get older. It's no, no. That was my limited thinking. By me not eating well, exercising, getting my mind straight, getting my hormones, which I couldn't have done without assistance. So.
Oh, there's another question here in the front. Oh, sorry.
You've talked about the 30, 40, and 50-year-olds. What about the ones that are even over that?
Oh, okay. I'm
About
so sorry.
preventing the
Okay, I'm going to talk to you. That's a
Especially
good point.
about the prevention of Alzheimer's, because
Yes.
I don't have to worry about that stuff anymore, but I still
Okay,
worry about Alzheimer's.
Yes, I have a friend who's practicing in the Villages. As you know, Villages is a town here. It's a town here in Florida where our population, our age is 60, 70, and 80. And she is a practitioner like me who gives bioidentical hormone, and she's a pulmonologist, and she did a study. I forgot to put on the slides, but in reference to that, there is no age limit to give this bioidentical hormone. In my own private practice, I have a 72-year-old, an 80-year-old, about 65-year-old. I would say a few of them, less than 20, that I have given back the bioidentical hormone pellet, twice a year only for them. And the reason being, it's not for sexual things, but it's for their energy. I was able to withdraw and actually limit the amount of prescription medications that they use. Most of them have pain prescription, hypertensive medication, and the way they describe to me, so it's never too late to do that. If they have an existing osteoporosis, hypertension, heart disease, it's already there, but it's not gonna get worse because the plan is to withdraw them from taking too many medication. The way they describe to me is they're able to get up and go. They don't feel the stiffness and the pain of joint pains of osteoarthritis. So there's no age limit. For memory, it's great to have the enhancement of your memory, especially for new things that are happening to you. So remember, the way that dementia works is you can't remember new things, new, not old, because you're always going to remember old because that's already programmed in your brain. The new things that are being remembered when they're on optimized bioidentical hormones. So there's no contraindication to give it for 60, 70, 80-year-old, provided that they never had a blood clot. So I tried to make sure that they're always going to be measured. So still evidence-based medicine, you have to measure before and after, usually 6 weeks to 8 weeks after. So in reference to your question, yes, it can, when optimized, testosterone helps with respiratory muscles. So those with chronic lung diseases improve breathing. The hypertension, high blood pressure improves. It lowers down, so we cut back their medication. I am an internist by trade, so I usually manage their diabetes, hypertension, and cholesterol, because you also see changes in cholesterol. The cholesterol goes down naturally when the hormones are optimized. Okay, so there should be no way to stop age. And I think they enjoy it because they stay functional. They can get up and go, enjoy their activities of daily living, and they can remember new things. So I think that is great. So there's one here by the front.
Here.
Yes, ma'am.
Wait a second.
Yeah.
So I wanted, can this be used to treat other conditions other than menopause or Alzheimer's or dementia? Because like in my situation, I have both PCOS and Hashimoto's, so I already take, the oral synthetic hormones. Is this more effective? Is it used for that purpose?
I have patients with PCOS. So for everybody, PCOS means polycystic ovarian syndrome. That means there are cysts, multiple cysts in the ovary, and this produces a syndrome where you gain weight, there's more hair production because testosterone in the opposite way is very high, it's not low, okay? And then there's also irregularity in menstrual cycle. Yes, there is a point here. We're not giving you testosterone, but you're going to be given cyclic progesterone. So we have to know your ovulation because you look like you're still young. How old are you?
36.
Yeah, so in a 36-year-old female with PCOS, we have to look at her cycles. That means I'm going to send her for blood works on day 19, 20, or 21st of her menstrual cycle, find out how much hormones does she have, and based on that, titrate and give you bioidentical hormone progesterone. Okay, and that could be in a pellet formula too. You don't have to be taking that. It could be cycled depending on your cycles. And Hashimoto's is a very tricky disease. So it's a thyroid autoimmune disease that causes Hashi is you go swinging from left to right. You're hypo and hyper and hyper. So it is a very difficult disease to treat, and that's why losing weight is an issue. So whenever we have a condition with Hashimoto's, what we have to do is look into everything from T3. I'm sorry I'm gabbling here like a mad scientist, but she understands me. T3, you understand me, right? Your T3, T4, your thyroid stimulating hormone, your TPO, your thyroid peroxidase. That has to be monitored well. And we have to look at food, okay? In correlation to your nutrition, there is such a thing as micronutrient testing. Once again, in Texas, I send my blood work to Houston. That's where SpectraCell, the lab work, will then check your iodine, your micronutrients. So what essentially makes your body work is the nutrients. That's why that nutrition lecture before my hormone is so important. We gotta correlate all of these together. And that can help you with your Hashi. So if you have a question, I'll give you my card, and so we can connect and we can send those lab work too. Okay, I'll help you out.
Did you know that?
I also do weight loss, so that will be something I can do in another topic. Yes, ma'am.
What is recommended for those that have had a pulmonary embolism from Premarin?
Oh, wow. Well, okay, first of all, you can't take any more estrogen, all right? So pulmonary embolism means there was a blood clot. How did it happen? The blood clotted because the estrogen produces the red blood cells, and it blocked the lungs. So with that event, you can never be, with that event, you have to be anticoagulated or giving a blood thinner. So you can never be on that, any synthetic replacement. But you still could be on testosterone if you needed it for your strength, for your bones. I wouldn't recommend estradiol. I'm very conservative when it comes to that. But with PE, because it's a coagulant effect, I would recommend estrogen. I would just recommend testosterone for safety. Any other questions?
One more, Joanne?
Yes.
Is it dangerous not to have any hormones?
Yes, it's dangerous because you're letting your body deteriorate when there is a means. Just like Carolyn and I have experienced, when there is a means to really regenerate and rejuvenate you, you would not want to go for plastic surgery. You want to rejuvenate from inside, which is replenishing your hormones and eating healthier. That goes hand in hand. Nutrition and bioidentical hormones are the best thing in order to age well and retain that you look youthful. So when you don't, those three are consequently going to happen. And we don't want to forget good memories. So, but yes, especially for those, there's a lot of sisters from Texas.
Someone just asked me where your practice is. It's in Orlando, Florida.
Yes. Yeah, in fact, for our widow sisters, I have given you, Carolyn, the lab work that you need to do. I have shared with Carolyn lab testing that you needed to do, so we'll put it on the website. You can ask your primary care doctors to run those tests from you, and if you want me to do a consult for you, even online or on the phone, we'll do that. And then you have to fly back here so I can put your and we can bring your sexy back for the next topic next year. I would love to do that. Oh my God, it will be more fun for that lecture. Thank you.